Hi ladies, I'm Aoife from Women's Health Dublin.ie. This video we're going to discuss rehab for week 2 post-delivery. And this can be for vaginal or C-section deliveries. So we're working on breathing and we're going to start to do some pelvic floor engagement. I must say, if you have pain when you try and activate your pelvic floor, then you're maybe not ready yet. So it depends on the grade of tear, the episiotomy, if there's an infection or anything. So if you try and activate your pelvic floor and it's painful, well then wait another week, or obviously see your GP or your pelvic health physio if you're 6 weeks postpartum. That's when we do our assessments. But see your GP if you have any concerns. But just if there's a high grade tear or an episiotomy, you just might still be sore there. So you can just keep working on the breathing from week 1. And if you're ready to start the pelvic floor work, then that's great. And again, the same for C-section. So this will, with our breath work, incorporate abdominals, pelvic floor, and diaphragm. And for anyone who's been pregnant, your pelvic floor have been lengthened, your diaphragm has been shoved up, your tummy is weak. So we're all doing the same kind of rehab at this stage, okay? So we want to go with gravity to line on our back because it's easier to work with gravity. In the coming weeks, we can get into standing and sitting, and you might find it easier to get them done, but we have to start with the easiest position. Loads of people are messaging me saying they just don't have time to get this done. That makes me so sad because we're talking about 2 minutes 3 times a day. And I know when you're, a mum, it's hard to even get time to go to the toilet or drink your cup of tea. But it's really sad, isn't it, that we can't fit in this 2 minutes 3 times a day. I'm trying to do it when I'm going for a nap, when I'm going to bed, when I wake up in the morning. So whenever I'm in a lying down position, I'm like, I'll just get them done. So I'm getting them done, and I have 2 kids myself. So just about trying to remember. But obviously as a women's health physio, I'm definitely biased and I'm prioritizing this versus a shower maybe. So what you're going to do is lie down on a mat or on the floor or on your bed. Knees bent like this, head relaxed. We're going to start with our breathing. So big deep breath in through the nose, into the lower rib cage. And now as you exhale, I want you to squeeze your back passage and keep exhaling, keep exhaling, keep exhaling, keep exhaling. And again, big deep breath in through the nose. Squeezing through the back passage as if you're trying to stop yourself passing wind. And if you can squeeze into the vagina as well, that's brilliant. But if you can only manage the back passage, that's fine. And then relax. Fully relax between each contraction. Give yourself a couple of seconds to make sure that you're fully relaxed. And again, breathe in through the nose. And exhaling through the mouth, squeeze the back passage, squeeze the vagina. Imagine you're trying to stop yourself passing wind or stopping the flow of urine. And fully relax. And again, breathe in through the nose. Right down into that diaphragm and tummy, and exhaling slowly and squeeze. Exhale, 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 exhale. We're aiming for 10 here. I often tell people count out loud because that'll make you keep breathing so you don't hold your breath. We really don't want you to hold your breath here. So breathing in through the nose. And count. 5, 4, 3, 2, 1. As you exhale, and then let everything go. And again, breathe in through the nose. Squeeze. Exhaling. 4, 3, 2, 1. And let everything go. Gonna do 3 more. Breathe in. Exhale. 5, 4, 3, 2, 1. Breathe in. Exhaling for 5, 4, 3, 2, 1. Let everything relax. 1 more. Breathe in through the nose. And squeeze. And exhale. 5, 4, 3, 2, 1. And relax. Now we're going to try 10 fast. So squeeze, relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. squeeze, relax. 5 more. Squeeze, relax. Squeeze, relax. Squeeze, relax. Squeeze, relax. 2 more. Squeeze, relax fully. Squeeze, relax. So we are aiming for 10 by 5-second hold. Now, if you can only do 2-second hold or 3-second hold, that's absolutely fine. I've kind of snuck on ahead, so I've been doing a few of these. So 5-second holds 10 times and then 10 fast ones. Squeeze, relax, squeeze, relax. So remember not to hold your breath. Fully relax between each contraction. Big, deep, intentional abdominal breaths to get that diaphragm moving. And then you're 10 fast. And then you're finished. So 10 by 5 is 50 seconds and 10 fast, another 10. 60 seconds. Give another 20 or 30 to get up and down. So 1.5 minutes, 3 times a day, just to look after your pelvic health right now, if you can fit that in. And stick this video on if you want. Put your headphones in and just listen to me doing the counting and directing you. If you're struggling with the techniques, please go and see your women's health physio, because sometimes it's really hard to know if the muscles are doing what you want them to. So if you're finding this hard, you need some help. This is Aoife from womenshealthdublin.ie.